Telemedicine is improving healthcare access. The city of Reno is an oasis in the otherwise unoccupied Nevada desert. Unless you live in Reno, the availability of healthcare in northern Nevada or eastern California has been a real gamble. Recently, however, technology has begun to close the wide open spaces between patients and doctors. Telemedicine promises to reduce the time it takes to see a doctor, the time spent getting there, and the cost. Renown Health, based in Reno, operates multiple hospitals in northern Nevada.
In this case, whether it's Winnemucca, Nevada, Elko, Nevada, Fallon, Nevada, how do you manage the 10,000 people that live in that community in such a way that they get that right care at the right time, at the right location, so that we can bring that cost curve for those medical expenditures under control?
That's the question Kirk Gillis, who heads the telemedicine program for Renown, has been trying to answer. The Renown Regional Medical Center is a tertiary facility with an 80,000 square mile coverage area in Nevada and eastern California. That's the same size as the entire state of Kansas. Elko in northeastern Nevada, for example, is 117 miles from the Utah border. It's more than twice that far to Reno, making for an expensive road trip.
When you look at the time lost from work, the cost of meals, hotel, caring for kids and parents, most of the people that live on the outer edge of our service area, it costs them about $800 to $1,100 to go see a specialist for a 15 to 30-minute doctor's appointment. That's a pretty big barrier to getting the care that you need when you need it.
Costly emergency medical help is often decided by the elements.
Helicopter rides in this region are $7,000, and when you get to areas, Mammoth, California, Bishop, California, Lone Pine, Elko, the helicopters can't travel those distances in those weather conditions. You're talking fixed wing air transport, and the cost is even higher.
Renown has embarked on a two-phase program, using telemedicine to connect rural clinics and patients to providers in Reno, and a hospital-based initiative to bring specialty care to outlying facilities.
So this is our telemedicine machine that we've purchased from Global Med.
The Carson Valley Medical Center is located in Gardnerville, south of Carson City. The large retirement population there has a difficult time traveling, so the availability of specialty care at the community hospital is a real plus.
That's the real benefit of telemedicine, is being able to get a specialist, a consultation, where the patient can just come right into our hospital, into this private room, and enjoy that privacy and be able to get a consultation within 10 days of the physician's request for a consultation.
We improve the quality of care in these rural communities by enabling specialists to collaborate with rural providers, and we'd reduce the cost of care by getting the patients treated earlier in their condition rather than later. And I think the patients really appreciate it. The feedback that we're getting in these surveys has been extremely positive.
25 specialties provide weekly blocks of time reserved exclusively for telemedicine patients, proof of the buy-in by Renown's healthcare specialists.
They really believe that telemedicine is a way to improve care in the rural communities. It's a way for them to kind of increase the outreach for their practices into these rural communities. And they also believe it's the right thing to do for our community and for our regional healthcare initiatives. It's been fantastic. We are looking to bring on 10 more specialties in 2013. We hope by the end of 2013 that we'll have 35 specialties up and running, and we're actively scheduling patients every day, every week with all of these different specialties.
Telemedicine is healthcare reform. With it, we can provide access to healthcare, keep healthcare costs under control, and reduce unnecessary costs, and provide quality healthcare to improve patient outcomes. Global Med is proud to be the worldwide leader in the new generation of healthcare delivery systems. I'm Roger Downey.